Cannabis, weed, herb, marijuana, the thing, chronic, pot, so many names for the same bitter grass. And it seems like Trinidad and Tobago is really high. Slaps knee is really high in terms of global standards, global markings in how much of cannabis use there is in this country. A recent study came out that revealed there's really high usage of cannabis inside Trinidad and Tobago, which shouldn't be a surprise for anyone who lives on these islands, but the part of that may be even more significant is the fact that also included in that study was a relationship between the usage of cannabis and psychosis. Psychosis meaning basically you're not having a solid grasp on reality. That's the quick way to describe it. But it's an illness, obviously. It's not just a regular thing where, you're just not feeling the world as it is. No. You are mentally ill and you don't have a really secure grasp on reality. Psychosis. And there's a strong linkage between cannabis use and psychosis. And the study went through to link those two inside of Trinidad and Tobago. The usage of cannabis here and the prevalence of psychosis. And I decided to go along with that a bit and look at some other studies into not only Trinidad and Tobago, but the linkage between that cannabis use and psychosis, and if that linkage is as strong as they make it seem, and if there are any other factors included in that. And we're going to dive into this because I really do think this is an important issue in Trinidad and Tobago, something I've said regularly. So I believe it's one of those kind of satire shows. I think it was South Park or Family Guy or some one of those spoke in one of their episodes about weed, about cannabis, and something that they said way back then, that cannabis allows even boring things to seem interesting. And I agree. That is a large part of it. Cannabis tweaks with your feelings of novelty in your brain. Like that feeling of something being new, cannabis interferes with that a little bit. So you could have the feeling of, hey, this is something new and cool for something that you've been doing every day for the last 20 years. And that could easily be why so often you see 30 men sitting on a block, sitting in an abandoned house, doing nothing all day, and they are very entertained by that because, they're all very high. And I agree in the sense that I think that is a problem for the country. If you have so many young men wasting away their lives easily, willingly, because they are under the influence of a drug that allows them to think wasting away their lives is really interesting, then that is a problem. And that could be killing our country's efficiency, killing our country's productivity on a global scale, because you're taking the most useful workers. Not saying that young women aren't useful, but in terms of economic labor, in terms of going out there to do even manual labor, the young men are the main part of that in nearly any society. Men and women are different. I don't care who says what, men and women are different. So if you are able to neuter an entire generation of young men to just sit in a corner, do nothing, and be very happy about that, you're killing the productivity of a country. So I think on a whole, Trinidad and Tobago loses out if we don't get an understanding of how to use this thing called cannabis. We're going to dive into that today. So if you are interested in this kind of content, please do hit that like button, drop a comment, tell me what you think. Are you a cannabis user, just by the way? Do you think that it can be used in a positive light to engender productivity instead of to take away from it? Do you think that you see the risk of this psychosis in many marijuana users? Drop that comment, let me know what you think. Let's dive into this. In the Guardian newspaper, report suggests 1 in every 5 T&T adults using marijuana. This is on Monday, November 14th. This was published. 1 out of every 5 adults may be using cannabis daily in this country, a recent international study has suggested. And compared to other countries, this is very high. Ha, ha, ha. I saw what you did there, Guardian. Compared to other countries, this is very high. Yes. Trinidad also has a high rate of psychosis compared to other settings that have been researched, and cannabis may be a contributing may be contributing to that, the study has suggested. This data forms part of the findings from the International Research Program on Psychoses in Diverse Settings Intrepid 2 report, which investigated psychotic disorders in India, Nigeria, and Trinidad. It's interesting that they used India and Nigeria as the other two to Trinidad. You know, racial makeup and all of that. We observed a very high prevalence of cannabis use in Trinidad compared to international findings, Dr. Joni Lee-Pow said. Lee-Pow revealed the findings during a virtual event. According to Lee-Pow, the research conducted by the Intrepid 2 team found that 19.6% of the people surveyed in Trinidad were daily users of cannabis. That's a lot. 19.2 is around 20%. TNT's 20% was compared to the data captured in the contribution of cannabis use to variation in the incidence of psychotic disorder across Europe report, which found that daily cannabis use in London was 11.7% and 13.1% in Amsterdam. Kanchipuram, India, and Hyderabad, Nigeria, were studied in the Intrepid 2 report. Both recorded daily cannabis use levels, which were less than 4%. I think these numbers, it would be very interesting to see exactly how these numbers were collected. If you're collecting it just based on self-reporting and self-reporting from what kind of cohort group, is it a cohort group that is from a college? Is it college educated? Is it lower than college educated? I think all of these bits of information might be very interesting to know, to really get an understanding of how to compare these, because yes, the number you get in Trinidad and Tobago might be 20%, 1 in 5, but who is to say that number 4% over in those places in India and in Nigeria is accurate? How did you collect those numbers differently than Trinidad? Was it the exact same methodology that was used in Trinidad? Was there any difference? It would be interesting to get into that, but I don't know. I haven't been able to access this study to read it exactly. The catchment area, though, of the Intrepid 2 study in Trinidad consisted of the municipalities of Diego Martin, Port of Spain, San Juan Laventil, Tunapuna, Piaco, Arima, Chaguanas, and Sangre Grande. The East-West Corridor and Chaguanas. If you know anything about Trinidad and Tobago, you'd understand exactly why those areas may just be the highest areas for the prevalence of cannabis use in the first place. So you would have focused on the really built up urban areas that do have drug and crime problems in many of those areas. So yeah, it's no surprise the number you get. Maybe if you took that across the entirety of the country, you would have gotten a lower number there. But if you take it from those really built up, more urban areas that are already known to some extent as being crime hotspots, and crime in Trinidad and Tobago is widely linked to drug use and drug sales, so it's not totally surprising when you look at the areas that were studied. The report focused on residents in the catchment area between the ages of 18 to 64. Prime cannabis use time. One of the ways in which we can investigate if cannabis has an association with psychosis is comparing cases. And when I say cases, I mean people who do have psychosis to matched healthy controls, so people who don't have psychosis, and essentially seeing if cases use more cannabis than controls. So they're looking at people who do have psychosis and people who don't have psychosis and seeing which of these groups uses more cannabis, checking the use of cannabis in between these groups. Lee-Pow said one of the things the study found is that Trinis use a lot of cannabis. Okay, so what we did find, well, we found a lot of cannabis in Trinidad. That's what we found, she said. Cannabis users more likely to develop a psychotic disorder. Lee-Pow said, according to the study, those who use cannabis more than once a week are twice as likely to develop a psychotic disorder, and those with a cannabis dependency are 5 times more likely to develop a psychotic disorder. It should be a bit alarming. I hope it is, Lee-Pow said. In TNT, at least 3 studies have confirmed that between 40 to 60% of first admission cases for psychosis are related to cannabis use, particularly for males. Lee-Pow said within Trinidad, the groups that use the most cannabis are Afro-Trinidadian men who also have the highest rates of psychoses. According to the UK's National Health Services, NHS, psychosis is when people lose some contact with reality. This might involve seeing or hearing things that other people cannot see or hear, hallucinations, and believe things that are not actually true. delusions. Leopold said the data showed that a quarter of the adults who used cannabis did so for the first time when they were under the age of 16. This, she said, was also high compared to international data. Half of those early users, so half of those who used cannabis before 16, went on to become adult frequent users. So definitely raising some questions about adolescent cannabis use and what kind of pathways it may lead to later on, she said. Now, I think this little bit of information might actually be one of the most important parts of information in this whole study, because I have done some readings on cannabis use before, and one of the things regularly spoken about is the age at which you start abusing or using cannabis. And the earlier you start using it, usually it has been found that earlier usage generally leads to worse outcomes. So if what you are finding in Trinidad and Tobago is that a lot of people are starting usage really early, it might be interesting to study that link between psychosis if there's an age-related concern about that. And in my readings, I came across an article from 2014, also from The Guardian, that spoke about a study in the United Kingdom. Again, daily ganja use tied to early psychotic disorder. In a study of adults who experienced psychosis for the first time, having smoked marijuana daily was linked to an earlier age of onset of the disorder, according to UK researchers. This is not a study about the association between cannabis and psychosis, but about the association between specific patterns of cannabis use and an earlier onset of psychotic disorders. So the study wasn't just studying cannabis and psychosis. It was studying how the usage of cannabis varied in relation to psychosis. And I think this is actually more important in terms of where the areas of study have to be focused in coming years, because what we're seeing is in Trinidad, we're seeing cannabis use decriminalized, and many people are pushing for it to be legalized. In the United States, many places have decriminalized it also, and I believe in this last midterm election, several places also legalized it too. We're seeing that push for legalization in many places, and I think when you have that push for legalization, an important discussion is not just if cannabis is linked to psychosis, because water is linked to drowning. But water drinking isn't necessarily a bad thing. So if you're going to have much more of your population being interested in possibly recreationally or otherwise using cannabis, it might be important to see if there are certain areas that or certain types of usage of this plant that make for worse outcomes. Some previous research has suggested that using cannabis might trigger psychosis in some people, especially those who may be vulnerable because of family history or related mental illnesses or specific gene mutations, but the evidence has been unclear. For example, one recent study from the Netherlands found it's equally possible that people prone to psychosis may be likely to smoke pot, possibly as a way of self-medicating. So is it that pot users get psychosis more, or is it that people susceptible to psychosis use pot more? Which one came first? And that's an important thing to look at. Is it that people who already feel like their grip on reality might be slipping a little bit, that those are the kind of people generally more influenced and more inclined to use marijuana, and those are the people, if they do use it, do see those negative outcomes because they already have those preconditions that make it easier for them to be susceptible to the psychoses. So is it that they have those preconditions that make them more likely to use this thing, and the usage of this thing now makes it more likely for them to fall victim to psychosis because of the preconditions they have? Which one is it? In the new study published in the Schizophrenia Bulletin, the researchers focused on patterns of cannabis use, gender, and relationship of those factors to the timing of a first psychotic episode. Age is significant. The 40 is the scientist in charge of the study, team notes in their report, because the teenage years and early 20s are a critical time for professional and educational development. So experiencing an acute psychotic episode for the first time early on may negatively affect the likelihood of achieving optimum level of function. They also found the patients who started using cannabis at age 15 or younger preferentially smoked high potency cannabis more often and had an earlier onset of psychosis than those who started using cannabis after age 15. The scientists in this study also cautioned that this study specifically focused on patterns of cannabis use among people who all developed psychosis, but did not compare them to users who did not experience psychosis. The thorny question is whether they might otherwise have developed the disease or would not have had the mental illness. It's a distinction we haven't figured out yet. It was emphasized it is important to counsel educators and parents about the risks of cannabis use in teenagers. I would try and understand why people use cannabis, what do they get from it first, and then engage them explaining how using daily, choosing high potency type can cause harm to their brain and increase risk of psychosis. So these are warnings coming through as we're seeing the prevalence of cannabis increase. The age of use is very important. What age do you start? And is it that the age of use being important in the negative outcomes in the future has to do with other factors? So if you start younger, they find that you generally use higher potency strains, which is not surprising. If you started smoking marijuana at 14, by the time you're 18, the regular marijuana is just too dead for you. You need something stronger. So you look for higher potency strains. And also connected with that is the ever known trope that marijuana is a gateway drug, meaning that, okay, you started with marijuana, but maybe as you go on and you want to get something stronger, you're going for something outside the realm of marijuana, cocaine, something else. So who knows if that's a point too. Then there's the fact that age group is the age where you go to school. That's the beginning of your work life, the ending of your school life. If the ending of your school life, beginning of your work life is shrouded by a cloud that taints reality a little bit, a cloud of smoke that taints reality a little bit, then who is to say that the factors that cause your life to be a little different and a little more difficult further on, and to do with just the bad decisions you make during that time? And speaking of bad decisions, is it that the marijuana use in young people, in teenagers, the cannabis use, is linked to other bad decisions being made in their life? Because yes, it's illegal for everyone, but it's probably more illegal for the younger people. If someone is already smoking cannabis at a young age, who is to say what other bad decisions they are making? So it's an important factor to look at. But beside all of those other limiting factors, there's also the reality that it seems cannabis use might actually have an effect on the brain itself when it's developing. That has been my understanding for quite some time now, but more and more studies seem to show that yes, it has an effect on the brain when it is developing, but it seems like it may even have an effect on the brain after it has developed. Age of initiation of cannabis. This is a study. Age of initiation of cannabis use predicts age of onset of psychosis, the 7 to 8 year trend. What they did here was they investigated what age people started first using cannabis at, and then the age at which they had onset of psychosis, and they checked those years comparing it to see what age someone started. So say they started at 14, what age did you see the onset of psychosis being developed? And a chart here positions and displays all of this. The age of initiation of cannabis you see here in chart A, and then the age of onset of the psychosis. And you see for people who started at the age 12, their onset is around the age 20. And the people that started at the age 22 plus, their onset seems to be at the age 32 upwards. Now, the study, when comparing the data using statistical analysis, they found that there wasn't actually a big difference in the amount of years between the beginning of usage of cannabis and then the onset of psychosis. Meaning that whether you started at 12 or you started at 18, the amount of years between your start and the psychosis was around the same. Seeming to say that, okay, it may not just be in the young people, it may be in all. But I'm looking at this chart as it's displayed here, and you're seeing a linear distribution. Linear meaning that it's about the same amount of years between all. But something interesting, the 22 plus age group seems clearly like it's lengthening, and that has been what I've heard from quite some time now, because some of you may know that the prefrontal cortex in your brain, this part, the front piece of your brain, it is said that fully develops usually sometimes up till the age of 25. So your brain is continuing development even into your 20s. So if it is that cannabis has an effect on brain development, which might lead to some of these negative mental health outcomes, it might not be that we're not seeing a difference between the onset of psychosis looking at from 12 to 18. That might not be the age group you have to look at. You may have to look at those younger age groups and then look at people who started cannabis use in their late 20s or into their 30s, and then see what the prevalence of the onset of psychosis is. Is it that anyone before that 25 age has that, and the length of time they said here was around 7 to 8 years, 6 to 8 years. So you have 6 to 8 years from onset of use, beginning use of, they're talking daily use here, they're not talking very occasional use, of very regular use. Is it that once you start that at any age, 7 to 8 years, is a possibility of psychosis, or is that a much higher possibility in the younger age group? And another study that I looked at seemed to answer that a little more accurately. Association between age of cannabis initiation and gray matter covariance networks in recent onset psychosis. So what they looked at in this study is the actual gray matter in the brain and seeing if there's a difference in the amount of gray matter, the development of your gray matter in the brain, and the age at which you began using cannabis. And this is the abstract of this study. Cannabis use during adolescence is associated with an increased risk of developing psychosis. According to a current hypothesis, this results from detrimental effects of early cannabis use on brain maturation during this vulnerable period. However, studies investigating the interaction between early cannabis use and brain structural alterations hitherto reported inconclusive findings. So they went in to find that out. Earlier cannabis use initiation was associated, this is what they found, with more positive symptoms in our cohort. Greater gray matter volume in the previous identified cerebellar schizophrenia related network had a significant association with early cannabis use, independent of several possibly confounding factors. So they looked at variable other factors. Maybe you have some pre-existing condition based on your genetics, something based on your family, something based on your diet, and what they found was regardless of those other confounding factors, the development of your gray matter volume, the actual brain itself, was most linked and clearly linked to early usage of cannabis. Moreover, gray matter volume in the cerebellar network was associated with lower volume in another network previously associated with schizophrenia. These findings are in line with previous investigations in healthy cannabis users and suggest that early initiation of cannabis perturbs the developmental trajectory of certain structural brain networks in a manner imparting risk of psychosis later in life. So this study and their investigation found that, it is that early usage while your brain is still developing that actually leads to negative results in the development of your brain and negative results in mental illnesses and mental health further on in life. So getting back to even the Trinidad study there, the initial 1 in 5 Trinidad study, 1 in 5 adults in Trinidad and Tobago use cannabis, and there's a link between the usage of cannabis and psychosis, and Trinidad has a high prevalence of psychosis. It would be very interesting to find out how many of those adult users with psychosis actually began in childhood, in adolescence. And is it that the usage of cannabis by mature adults actually has very little risk factors, and the main risk factor is in the early usage? That's something that has to be passed out, has to be decided, has to be figured out, because as we're seeing down the pipelines, the legalization of cannabis, the allowing of the use of recreational weed, is it that now we're going to have to look out even more for the younger people using it? Because something that I've said in legalizing drugs, in legalizing nearly any drug, but especially particularly cannabis, I am not sure the legalization of cannabis would greatly increase the usage among adults. I am not sure about that, because in a country like Trinidad and Tobago, obviously, access to cannabis is not a difficult thing. So the most people who do not use cannabis do not use it because they don't really care to use it. And just about anyone who really is curious about trying it has tried it or uses it currently. So legalizing it, I don't think may have a huge effect on the adult population, but legalizing it may indeed have an effect on the access to young people, to adolescents. A young population may have greater access to cannabis if it is legal in the whole entire population. And if it is that we find psychosis has a really strong link with early usage, early exposure, that would be a very important fact that we would have to deal with, whether it be societally in terms of having social safeguards, or even in the legislative sense, where you of course, even if they legalize this, almost surely it would have an age limit. But if such an age limit would be something that would be very seriously prosecuted because of the likelihood of further negative results in the young people with exposure. Tell me what you think. Do you see this as being a feasible reality, that it is the early usage, or do you see it as being a usage on an entirety? To me, when I talk to many users of cannabis, you could tell the people that started using cannabis at a very young age. You could kind of this is anecdotal here. This isn't a study. This is my personal experience. The people that use it from a really young age, yeah, you could kind of tell. And then there are some people that started later in life, and you may never even know. What do you think? Drop a comment, hit that like button if you are not yet subscribed, hit the subscribe button and that notification bell to see when next new videos drop, and I will see you in the next one.